Vitamin D rich foods vegan play a pivotal role in maintaining optimal health, particularly for bone strength, immune function, and overall well being. For those following a vegetarian or vegan lifestyle, sourcing these vital nutrients might seem challenging, but rest assured, nature offers an array of plant-based options brimming with vitamin D. Imagine vitamin D rich food vegan as the sunshine superhero for your body. This fat soluble vitamins is like the guardian of your bones and overall well being. You can recruit these mighty nutrients through various means, including soaking up some sunlight, indulging in vitamin D rich foods vegan, or teaming up with reliable supplements. But beware of the villainous deficiencies. A shortage of these superhero nutrients could lead to serious health woes like osteoporosis and rickets. Remember, maintaining a balanced team of nutrients is the secret to keeping your body and mind in superhero shape. Now, let's talk vitamin D rich food for vegan. Now that we understand the significance of addressing vitamin D deficiency, let's explore a diverse array of vitamin D rich food perfectly suited for a vegan lifestyle. Whether you are a seasoned vegan or someone considering a plant-based diet, incorporating these foods into your meal can make a significant impact on your overall well-being. First, sun-kissed mushroom. Certain variety of mushrooms have a unique ability to produce vitamin D rich foods vegan when exposed to sunlight. Just like our skin, include mushrooms such as maitake and seitak in your dishes for a flavorful boost of these essential nutrients. Second one is fortified plant-based milk. Almond milk, soy milk, or other plant-based milk alternatives are often fortified with vitamin D rich foods vegan, making them excellent additions to your morning cereal or coffee. Check the labels to ensure the products are fortified with vitamin D2 or D3. Next, third one is nutritional yeast. The staple in many vegan pantries. Nutritional yeast not only adds a cheesy flavor to dishes but also pack a nutritional punch. Look for fortified varieties to enhance your meal with an extra dose of vitamin D rich foods vegan. Fourth one is tofu and tempeh. These versatile plant-based protein sources are not only rich in nutrients but can also contribute to your vitamin D intake, especially when prepared with sun-exposed mushrooms. Fifth, vitamin D fortified cereals. Start your day with a bowl of vitamin D fortified breakfast cereals. Many brands offers plant-based options that can be an easy and tasty way to meet your daily vitamin D requirements. Sixth one, sunflower seeds. Packed with essential nutrients, including vitamin D rich foods vegan. Sunflower seeds make for a convenient and wholesome snack. Sprinkle them on salads or enjoy them on their own for a crunchy delight. Seventh, vegan vitamin D supplements. While it is always preferable to obtain nutrients from whole foods, vegan vitamin D supplements can serve as a reliable backup. Seek guidance from a medical professional to ascertain the appropriate doses tailored to your specific requirement. 8th one, mushroom-based vitamin D2 supplements. For the entirely plant-based supplement option, mushroom-based vitamin D2 supplements are available. These supplements harness the vitamin D producing power of specific mushrooms. Importance of balanced nutrition for strong bones and joints. Now that we have uncovered an array of vitamin D rich foods vegan, suitable for a vegan diet, let's explore the interconnectedness of vitamin D with other essential nutrients, namely iron and magnesium. A well-rounded diet that encompasses these vital elements is not only beneficial for your vitamin D intake but also play a pivotal role in maintaining strong bones and joints. First, the trio: vitamin D, iron and magnesium. Understanding the synergy between vitamin D, iron and magnesium is key to comprehensive bone health. While vitamin D aids in calcium absorption, iron contributes to collagen formation and magnesium play a role in bone mineralization. Ensuring an adequate intake of all three is fundamental for overall skeletal well-being. Second, plant-based iron sources. Vegan can derive iron from various plant-based sources such as lentils, chickpeas, tofu, and fortified cereals. Combining these iron-rich foods with vitamin C-rich fruits and vegetables enhances iron absorption, promoting optimal iron levels. Third one is magnesium-rich vegan foods. Leafy green vegetables like spinach and kale, nuts and seeds, whole grains, and legumes are excellent sources of magnesium. Including a variety of these foods in your daily meals ensure you are meeting your magnesium requirement for robust bone health. Fourth one is creating balanced vegan meals. Crafting well-balanced meals involves thoughtful consideration of each nutrient. For instance, pairing vitamin D food, vegan mushroom with iron-rich tofu, or legume and magnesium-loaded leafy greens can create a synergetic effect, maximizing the absorption and utilization of these essential nutrients. Fifth one is meal planning tips. Diversify your plates. Include a colorful array of fruits and vegetables to ensure a broad spectrum of nutrients. Pair smartly. Combine vitamin D rich foods, vegan, with plant-based iron and magnesium sources to create nutritionally dense meals. Consider fortified foods. Integrate fortified products strategically to enhance your nutrient intake. Sixth one is consulting a registered dietitian. For personalized guidance on crafting a balanced vegan diet that support bone health, consider consulting a registered dietitian. They can provide tailored advice based on your individual nutritional needs, ensuring you are on the right track to meet your health goals. Now, symptoms of lack of vitamin D rich foods begin. The function of liver or kidney is affected. Feeling tired all the time, persistent fatigue despite maintaining a balanced diet and getting 7-8 hours of sleep each night could be a sign of vitamin D deficiency, as insufficient level of this vitamin are known to contribute to heightened fatigue. The main reason for vitamin D deficiency may be that you cannot get enough sunlight. If the color of your skin tone is getting dark, then it is because of vitamin D deficiency due to dark skin. Vitamin D is not absorbed properly by sunlight. You often have backache and bone pain. Then this can also be sign of vitamin D deficiency. If you feel depression and anxiety all the time and your mood worsens, then it can also be a sign of vitamin D deficiency in your blood. Now, type of vitamin D. Vitamin D is of two types. Vitamin D2, it is also known as ergocalciferol. Vitamin D3, it is also known as cholecalciferol. Problem caused by vitamin D deficiency. Vitamin D deficiency can cause a range of health problems, some of which can be serious. Weak bone. As mentioned, vitamin D is essential for the body to absorb calcium, which is necessary for strong bones. When there is not enough vitamin D, the body cannot absorb enough calcium, which can lead to weak bones and an increased risk of osteoporosis. Rickets. In children, severe vitamin D deficiency can cause rickets, a condition that leads to softening and weakening of the bones, causing them to bend and become misshapen. Cardiovascular disease. Vitamin D deficiency has been linked to an increased risk of cardiovascular disease, including high blood pressure, heart attack, and stroke. Diabetes. Vitamin D deficiency has been associated with an increased risk of type 2 diabetes and may also play a role in the development of progression of this disease. Immune system. Vitamin D play an important role in supporting the immune system, and deficiency can lead to an increased risk of infection and a decreased ability to fight off illness. Depression. Low level of vitamin D have been associated with an increased risk of depression and other mental health problems. Cancer. Some studies have suggested that low level of vitamin D may be associated with an increased risk of certain type of cancer, such as breast, prostate, and colorectal cancer. Now, vitamin D overdose can be fatal. Vitamin D overdose, also known as hypervitaminosis D, can occur when there is an excessive intake of vitamin D. While vitamin D is an essential nutrient and is necessary for good health, taking too much can be harmful. Symptoms. Symptoms of vitamin D overdose can include nausea, vomiting, loss of appetite, frequent urination, excessive thirst, muscle weakness, joint and bone pain, and a high blood calcium level known as hypercalcemia. Health effect. In severe cases, hypervitaminosis D can lead to life-threatening health problems such as kidney damage, heart problems, and a high blood calcium level that can cause calcium deposits in tissues and organs. Overdose sources. Vitamin D overdose can occur from taking high doses of supplements or from exposure to excessive amount of sunlight. It is important to talk to a doctor before taking vitamin D supplement, especially if you are at risk of overdose, such as individuals with kidney or liver disease or those taking certain medications. Menstrual irregularities. High level of vitamin D has been associated with menstrual irregularity, including irregular periods and menstrual pain. Pregnancy. During pregnancy, excessive vitamin D intake can lead to high blood calcium level, which can be harmful to both the mother and the fetus. Hypercalcemia. Excessive vitamin D intake can lead to high blood calcium level known as hypercalcemia, which can cause nausea, vomiting, loss of appetite, frequent urination, excessive thirst, muscle weakness, joint and bone pain, and even organ damage. Kidney damage. Excessive vitamin D intake can put a strain on the kidney and lead to kidney damage, especially in individuals with pre-existing kidney problem. Heart problem. Hypercalcemia can lead to heart problem, including abnormal heart rhythm, which can be life-threatening. Bones. Although vitamin D is important for maintaining healthy bones, excessive intake can lead to an increased risk of osteoporosis and fractures. Interaction with medications. Excessive vitamin D intake can interact with certain medications, including those for high blood pressure, heart disease, and osteoporosis, potentially causing adverse effects. Group at risk of vitamin D inadequacy. Several groups of people are at risk of vitamin D inadequacy, including older adults. As people age, their skin is less efficient at producing vitamin D from sunlight exposure. People with dark skin. Melanin, the pigment that gives skin its color, decreases the skin's ability to produce vitamin D from sunlight exposure. People who are homebound, people who spend most of their time indoors or in area with limited sun exposure are at risk of vitamin D inadequacy. People with obesity. Excess body fat can decrease the body ability to absorb vitamin D. People who follow a strict vegetarians or vegan diet. Vitamin D is mainly found in animal-derived foods, making it difficult for vegan and vegetarian to get enough of these nutrients. People with fat malabsorption disorder. Certain medical conditions such as Crohn's disease and cystic fibrosis can decrease the body's ability to absorb fat-soluble vitamins like vitamin D. It is important for this group to get their vitamin D levels checked and to consider taking vitamin D supplement or eating vitamin D rich food to ensure adequate intake. Now, the treatment of excessive vitamin D. Excessive vitamin D can lead to a condition called hypervitaminosis D, which can result in high calcium level in the blood. Treatment for this condition typically involves discontinuation of vitamin D supplement. If the excessive vitamin D intake is due to supplements, they should be discontinued immediately. Decreasing dietary source of vitamin D. Food high in vitamin D, such as fatty fish and fortified dairy products should be limited in the diet. Increased hydration. Drinking adequate amount of water can help increase the exertion of excess vitamin D and calcium through the kidney. Using medications. Medications such as bisphosphonates or calcitonin may be prescribed to reduce calcium absorption and low blood calcium level. Monitoring of vitamin D and calcium level. Regular monitoring of serum vitamin D and calcium level is important to ensure the efficacy of treatment and to adjust the treatment plan if necessary. It's important to note that the treatment plan for excessive vitamin D rich foods vegan will vary depending on the severity of the condition and the underlying causes. Therefore, it is important to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan. Ensuring a vegan diet is rich in vitamin D is not just about meeting a nutrient requirement. It's about laying the foundation for enduring health. The spotlight on mushroom, especially those basking in sunlight, reveals a natural vitamin D powerhouse. Complementing this, fortified plant-based products like milk alternatives, cereals and tofu offer convenient avenue to fortify your diet.